Hello students, this is Dr. Praveen Tripathi and with me is the legend himself, Dr. Gobind Rai Garg sir.
Namaskar.
Students, this video is specifically for FMG students who have passed the FMG exam and who now have to prepare for NEET-PG or INI-CET. So, Gobind sir, first things first, for how long can we celebrate? It's been, I think, almost 3 weeks or 4 weeks since the result was announced. So, for how long can they celebrate? Because FMG examination was also a tough exam to pass. And when should they start studying seriously for the next step?
So basically, you deserve a good break, and you have already got that. So 3 weeks are good enough time. So take 3-4 more days, and now it's the time to be serious for PG entrance.
Right. So enough of celebrations. Now get ready for the next battle. Guga sir, in last 20 years, you have seen so many FMG students achieve such good scores, but some of them do well in NEET-PG. Some of them they start struggling. So what are the mistakes that we have seen FMG students making?
So the most important mistake which I have noted is that not to believe themselves. So that is the biggest mistake the students do. They think that they are less than the Indian medical graduates, and this is not a case at all. The most important thing is it is an entrance exam. You have to compete with the other one. So whosoever studies better, that will get a better rank. That's the obvious thing. It doesn't matter whether you are IMG or FMG. So the most important thing is to underestimate yourself or not believing yourself.
Correct. So Goga sir said a very important thing. Belief is very important. And students, when it comes to PG entrance or FMG examination, finally hard work starts playing a much bigger role. Because see, our exams are going to be fact-based. A significant number of questions would be fact-based. The person who studies more, who spends more hours, will end up remembering more facts. Of course, concepts are important, but it's not like physics or chemistry, right? So hard work plays a much bigger role. Guga sir, if I may add, another mistake that students do is this. Yes. Once they are done with the FMG examination, they go in that enjoyment mode. For 6 months, 8 months, they enjoy. And then when they start studying again, it is very difficult to get back into that rhythm. So another mistake, a big mistake is not starting soon enough.
So I would like to add this.
Right.
So this is a big mistake. So what is important is at present the knowledge is in your brain.
Right.
So you have just passed FMG exam. Lot of knowledge is in your brain. So if you start studying now, you have to just add on a little thing.
Right.
But after 6 months, you have to first come back to same level. So that will spend another 3 months. So in the end, you will not have enough time.
Right.
So that's why it is important to start soon.
So rhythm, as Goga sir said, rhythm is very important. Don't lose the rhythm. Otherwise, you will be starting afresh and it's going to be difficult. Goga sir, going back to the first point, role models are very important. Right? Like Goga sir is from my college. As a student, we used to look up to him. That if Goga sir did something, let us also try. So role models are very important. And in the last few years, what is happening is FMG students are doing exceedingly well in both the examination. Goga sir, we discussed about this. One of the happiest moment for us in NEET-PG 24 was when we saw that rank 10 was a FMG student. So people who tell that FMG students would struggle and it's FMG is just a pass-fail examination, you would not be able to crack the NEET-PG. This student gave them a befitting reply, gave them a befitting answer. So please remember students, if you do it rightly, you can get rank 10 and it's a matter of time before somebody removes this 0 and rank 1 would be FMG. Goga sir, your thoughts?
Totally agree. Now, what is more important is rank 10 is okay. But I am happy is that there are hundreds of students between 100 to 5,000 rank. So previously this was not the case.
Right.
So now the FMG students are doing exceedingly well. So rank 10 is only seeing that only 1% out of 10. But if you see top 5,000 students, there will be plenty of FMGs. So that is very, very encouraging to see that FMG students are studying and they are no less than anyone else.
One reason, Goga sir, I believe is that the FMG examinations are getting tougher.
Yes.
So the difference that was there earlier is no longer there. So somebody who has passed FMG examination already has a good hold.
Yes.
And also what we saw this year, students are getting 250, 240.
Yes.
So I mean the difference is not so much.
So this year 220 plus are plenty of students.
Plenty of students. All right. So yeah, this is something that we were discussing. How different is NEET-PG or INI-CET from FMG examination? So students, this is something that we can, very confidently say. If you had asked this question 5 years back, we would have said that if NEET-PG is at a level of 8 And if INI-CET is at a level of 10, FMG was at a level of say 4 or 5. But now if NEET-PG is at a level of 8 and INI-CET is level of 10, maybe FMG is at a level of 7 or maybe 6, not lower than that. Goga sir, what do you say?
Totally agree. Now the questions which are being asked in FMG, they are quite a lot conceptual and lot of clinical questions are being asked. So gone are the days when only you will rectify that you see the previous year questions and answer, you can get this pass FMG exam. So now the students who are passing the exam, they are knowledgeable.
Right.
They are not that they have just rectified and passed the exam. So that means the difference is not too much. Yes, difference is there. Major difference being that there is a negative marking.
Right.
Plus the second difference, important thing is 5%, 10% difficulty level is more. So now the difference in the level of FMG and PG is not too much. Earlier it was, as Dr. Praveen said, it is level of 4, 5 to 10. Now the difference is hardly 5 to 10%.
Right, correct sir. But at the same time, there is some difference, as Goga sir rightly mentioned. One is the difference of negative marks, right? So in FMG examination, you would not care for negative marks. If you can get 150 correct, you are through. But now you have to ensure that you are getting the questions right and the negative marks are minimum. And the bigger difference is that it's an entrance examination. You have to do it better than others. You have to get better marks than others to crack it. Getting a score is not enough. So question level, quite similar. Competition, definitely there. So efforts that are required are also going to be higher. So see, we don't want to sugarcoat it. We want to say as it is. So competition is more, difficulty level slightly more, and efforts required would be at least 2 to 2.5x of what it was to pass the FMG examination. But the good thing is, you pass the FMG examination in 6 months, maybe 5 months of study. Here you get more time. And the whole fact, which is a very unfortunate fact, that it takes many months to get the internship, we can use it to our advantage, because we get more time to study also. So after passing FMG examination, at least you are getting 1.5 years to prepare for the NEET-PG or INI-CET exam.
So another thing I want to add is, because there is negative marking, so what is important is you need to see which question you can leave or which question you must attempt. Because in FMG that is not in your brain, because you have to mark every question, whether it is right or wrong, you know or don't know, you have to mark. But here you have to be very skeptical whether you need to attempt this question or not, because you will get negative marks. So that entails a role of lot of question practice, so which is little lesser in FMG exam. But in PG exam you have to have a lot of MCQ practice, so that you can have less negative mark.
And also you have to have strong concepts. Yes, it's going to be very important. So challenges, Goga sir. First challenge is, as you said, first challenge is going to be the challenge at the level of belief system. You have to overcome that thought that I am a FMG, an Indian student might know more. All of that is plain nonsense. You have to get rid of those thoughts. You have to commit to the exam and you have to study properly. So first challenge is at the level of your mind. Second challenge is at the level of schedule, and that is where we come in. We will be talking in details. The common mistake, Goga sir, you have said this in multiple videos. Students start studying one subject, they give 3 months.
Yes.
Second subject, they give 2 months. And finally the exam comes and they have not completed anything. Schedule, a structured program is the need of the hour. So you have to overcome these two major challenges. And as Goga sir talked about, the challenge of approaching a question in a different way. So Gobind sir, our suggestion is going to be in 2 phases. 15th June we have NEET-PG exam.
NEET-PG 25.
25. We anticipate that in 2 weeks the results would be announced, and somewhere around 15th of July we will start with our Mission 3.0 program, the program that Cerebellum does, which is aimed towards passing NEET-PG or INI-CET. We are sitting in the middle of Feb. So we have got March, April, May, June, July, 5 months before the Mission 3.0 starts, and then probably an year after Mission 3.0 starts. So we have divided our schedule in 2 parts, before Mission 3.0 starts, after Mission 3.0 starts.
So I want to clarify those who are not aware of the terms of 2.0, 3.0.
Okay, yeah.
So Mission 2.0 is currently running program, the live lecture program, just like we had for FMG students. So that is targeting the NEET-PG 2025. Whereas after the NEET-PG is over, 25 is over, we will be giving another schedule, that is NEET-PG 3.0. This will be targeting the November INI-CET as well as the next NEET-PG, that means NEET-PG 2026. So we believe that most of the students who have just passed the exam, they will be giving NEET-PG 26 or
beyond.
Or you can say INI-CET near about that.
Right.
So you have near about 1.5 years.
Right.
So we are dividing the schedule in 2 parts. The first part will be the first 4 or 5 months which are left before the introduction of Mission 3.0. And second, after that you obviously need to follow Mission 3.0 blind.
So let's talk about the strategy. Now we talked about, sir talked about solving MCQs, we talked about concepts. So to do all of that, we'll have to follow a combination of our main videos, Mission live lectures, and also BTR. BTR, as most of you must be aware, it's the revision program that is run by Dr. Zainab. To ensure the hold on MCQs, we have got multiple things. ENDs, as our Mission 200 plus student already know, ENDs are the tests and discussions which are done live after a subject is over. Midday module is a group of selected questions which are chosen by the faculties themselves, which are given in the afternoon. Late night PYQs, as the name suggests, late night previous year questions and previous year topics also. So theory part with the help of main videos, theory part once the mission classes starts with the live lectures and BTR, MCQ part with the help of test and discussions, midday modules and late night PYQs, and of course the grand test. So we'll talk about these in more details in the upcoming slides. So this is a schedule that Goga sir himself has created for the students. Goga sir, please.
So I think before the start of the Mission 3.0, so you have nearly 4 to 5 months. So what I want is in these 4 to 5 months, you should finish nearly 10 subjects. Yeah? So we have given schedule. I have made the schedule according to the subjects which I want you to be thorough with. Yeah? So all these you have to do from the main videos. And I have calculated the hours, how many hours topic is there. According to that I have given, so that you need to do 5 to 6 hours video in one day, not more than that. So what is important is I will want you to do minimum 10 subjects. Out of this, 5 or 6 are big subjects or 4 or 5 are some small subjects. And if you already have very strong grip on some subjects, suppose someone says that I have very strong pharmacology, then instead of pharmacology you can add some other subject at that place. So you can customize that, but at least these 10 subjects you should know thoroughly before the start of Mission 3.0. I have given enough time. You can see that for pharmacology nearly 15 days I have given. So what you will do, I have given proper schedule. Like if you are starting from 18th of Feb, so on first day do general pharmacology around 5 hours video, general pharmacology around 7 hours. So 5 hours you will cover here. Then next 3 hours you will cover in the next day plus some part of ANS. So you can make that daily you have to study 5 to 6 hours of videos. Yeah? Apart from that, after doing the videos, you will solve the questions. Solve the questions sideways. Plus do not miss the midday module and late night PYQ. That you have to do daily without fail. Daily from now till 1.5 years. So for next 18 months you have to do these 2 things daily. Do not break that.
So, as Goga sir said that after studying say General 1, General 2 and ANS, you can do the custom module also. So in the app you get the option of doing the questions topic wise. So you can make a custom module of say the topics.
Praveen, I would like to add, because I have divided in such a manner that the number of questions will be around 60-70 only.
Okay, sir.
So that means you can do entire Q bank.
Okay.
You can do entire Q bank of that topic. Like if you are doing general pharmacology, so on the first day, general pharmacology have 80 to 90 questions only. So you can solve all of them. Okay. So no need of making custom module. If you are feeling that you cannot do 80 questions, even 80 questions are finding to be difficult, then you can make custom module. Otherwise, I have made such a schedule that you can do entire Q bank in that time.
Perfect, sir.
So these 10 subjects you can give. Like in pharmacology, you have finished anti-cancer and all these things by 28th Feb. After that, give 3 ENTs. 2 or 3 I have given in different subjects. So see the previous ENDs. Any 3 you choose according to your will. Any 3 END, give, listen to the answers and what the teacher is saying, find out where your mistakes are there, and immediately go back to the main video and see why you have made it wrong. Whichever topic is weak, make that strong. So E&D you can give in 2 hours to 1.5 to 2 hours, then discussion will be 2 or 3 hours, and after that you have a lot of time. So do not waste that time, see the weak topics during that time. So 3 days I have given for E&Ds, and then 1 day I have given break. If you have missed anything you are not able to cover, you can cover that also. And even during E&Ds you can do cover up.
So basically, just a point I want to add, that you have to go into the test section. In the test section, you'll have to go to the subject test, go to pharmacology. You'll see many ENDs of pharmacology.
Yes.
Sir is saying that choose any 3. Maybe you can choose the 3 latest ones if you want to, right? But you can choose any 3. Right, sir. Please continue.
Yes. So this is the schedule for almost every subject.
Right.
So
we started pharmacology. The good thing that sir has done is he has given so many days. Let's say if you saw this video on say 22nd, 23rd of Feb, still you have got 11 days to complete pharma.
Yes.
So what is the duration of pharma main videos?
58 hours.
58 hours. So 58 hours in 11 days, still very doable, right? And this is the case with all the subjects. So if somebody is starting say on 1st of March also, even then the person has time. But this is for those who are watching this video later. If you are seeing this video today, please do follow the schedule.
So because I have started from 18th, we are recording this on a Valentine Day, 14th. So it will be live maybe tomorrow, maybe day after tomorrow. But by 18th you should start.
So after pharmacology, Goga sir wants you to do anatomy. The structure remains the same. Topics, ENDs, break. Then we go to pathology. Topics, ENDs, break. PSM. Then we have OBG. And then sir has included some shorter subjects like dermatology, anesthesia, psychiatry, orthopedics, and surgery. So this is the broader schedule. But see, if you follow the schedule, you would be done with almost 10 subjects, and out of those 10 subjects, we have bigger subjects like surgery and OBG, pharma, anatomy done, and you will be in a very pretty situation on 22nd of June. And mission 3.0 is going to start around 15th of July. So sir has also given a buffer of 30 days. In these 30 days, either you can catch up with the subjects, and if you are a student who has been following all of this sincerely, in these 30 days, you can also complete 2-3 more subjects. Right, Goga sir?
Yes, definitely.
So now we have reached 15th of July, and now we start with the big thing, mission 3.0. So our FMG students who were a part of Cerebellum Mission 200 Plus already know how mission works. But those of you who are not a part of Cerebellum, in mission program, what we do is we have 3 labs. Lab 1, Lab 2, and Lab 3. Lab 1 is the detailed version. In detail, classes are taken. Say, Goga sir will teach pharmacology in at least 4 days. These are live classes. They start at 5:30 in the evening. They continue till 11 p.m., 10:30 p.m., maybe 11:30 p.m. And in these 4 or 5 days, Goga sir will complete everything. After that, there would be an END in which there would be a test followed by a discussion. And similarly, we will cover other subjects. These mission classes are in sync with BTR as well. So that say you completed the Goga sir's pharma lecture. Sir covers almost everything. After that, covering BTR would be a matter of a couple of hours. You can, you make notes. If you find anything new in BTR, you just add it. So mission programs are in sync with BTR as well. And then we talked about midday modules and late night PYQs. They are all in sync with these mission classes. Goga sir, what is this Lab 2 and Lab 3?
So Lab 2 and Lab 3 are basically the revisions. And so after you have completed one reading thoroughly, then there will be revisions. So Lab 2 will be a little quicker revision, and Lab 3 will be a marathon case. So you will finish everything in last few days. As you must be knowing from the FMG, the procedure is same. But we usually get more time. So rather than only ENDs, we usually add revision classes as well. Also, yeah.
But it totally depends upon the duration available. If we get NEET-PG date earlier, maybe we'll give only with ENDs. All of that will depend upon the NEET-PG date. Goga sir, you talk about certain things when it comes to GTs always, and it's very important to hear from him. Goga sir.
So GTs are the basically net practice. So you are going to exam, but you need lot of practice for that. So GTs, the major role of grand test, the most important role is that you are actually practicing the actual exam. So when you sit for a GT, think that it is the actual exam you are giving. So make the similar conditions. You will not move from your chair. You will sit on the chair continuously 3 hours. You are giving the GTs and no tea break, nothing in between. plus try to simulate the other conditions also, like there is no distraction, no, your brother is not coming in between, the maybe sometime fan is off, because in center you don't know how much condition you get. So number one thing is to simulating the actual exam. Now, why GTs are important? Scores may be vary. Scores doesn't matter that much. But what is most important thing is, if you make some mistake in a grand test, that is unlikely you will make same mistake in the actual exam, because that is the major rule. You give the GT, see where you are going the mistakes. What are the problems? Which topics are weak? But most importantly, if you have seen where you have made the mistake and rectified that, in actual exam, that mistake will not happen again. So that should be the most important role of the GTs. Do not worry that my score will be less, I will not give. So if you are not giving a GT, you are decreasing the chances of getting correct answer in the actual exam. So GTs should be regularly given, whatever GTs we give in cerebellum. So right from 18th of Feb only. So whatever GTs will come, you have to appear for each and every GT.
Don't think that I need to cover these many subjects before I start with GT. As Goga sir said, GTs have three important roles. First is, they are a preparation tool. The mistakes that you make in GTs, you never repeat them in the exam. Secondly, they are a practice tool. And thirdly, they are of course an assessment tool. So GTs, and another thing in cerebellum, we always say we'll give you a GT which is going to be closer to the actual exam. We are not here to impress you with our questions. We are here to give you those questions which may or which are likely to come in the actual exam.
And that is in fact very clear cut. Most of the students I have interviewed, their last GT score and the actual FMG score was only plus minus 5. Right. So that is the evidence.
And here we have written GT, the curve, right? So sometimes what happens, or sometimes rather than sometimes, in most of the cases, what you see is, in the initial GTs, your score is very less and it does not increase. This is the time when you start feeling frustrated that I'm studying, I'm completing subjects, but my score is not increasing, because you study one subject, you forget the other subject. But what happens is, after some time, maybe 4 months, 5 months, 6 months, suddenly the score starts to increase. And then it may be actually an exponential increase. So don't get too disappointed during this phase. It is a part and parcel of every student's preparation cycle.
Bas lage raho. That is the important.
Goga sir, notes to be used.
So at present, I will advise you to use the main notes. If you can make your own, it will be best. But I know that time is a constraint, and plus everyone is not in a habit of making their own notes. So if you are not able to make your own notes, I will advise to use the main notes at present. Clear? So particularly for the Mission 3.0 before session. Clear? After Mission 3.0 start, you can use these same notes. But if you are not comfortable covering other subjects, then at that time you can order the workbooks or quick revision notes, whatever you want.
So starting with main notes, you may continue with it, or later on you may go on to workbooks or quick revision notes. Alright, so when you subscribe to Mission 2.0 program, and don't get confused, as of now it will say Mission 2.0, but if you are a part of Mission 2.0, you would automatically get access to everything that happens in the app. When 3.0 is launched, you will get the content of 3.0 as well. So if you subscribe to it, you will get access to complete recordings of the main videos. Cerebellum main videos are available in English as well as Hinglish, except medicine.
So here I will want to add, whatever I have schedule made, if you are comfortable with English videos, you can go for that also. Like in pharmacology, I will highly recommend you will go with Hindi videos, English videos. And if you are not, obviously, then you can do the English videos. Both are equal.
The content is same.
Content is same.
But sometimes when you see a English video, and if you are from a northern part of the country, you are able to understand it better. But the content remains the same. Quick revision videos, again, both in English as well as English, except medicine, you get access to it. You get access to the entire Q bank. Our Q bank is very conceptual. In our Q bank, what we do is, there's a question, there's an answer, explanation to the answer, explanation of all 4 options, and finally, the best part, educational objective. Goga sir, why do we add this educational objective?
So educational objective will summarize about that question. So later on, when you are revising the questions, so you do not have time to read all the explanation in detail, then only you can see the educational objective, your question is done.
A lot of effort has gone into making these educational objective. The only reason is to ensure that when students don't have time, they can still go through all the questions. Grand test, of course, you have to prepare for grand test. BTR by Zainab ma'am is a part of it. Everything which is there in the app, as far as the NEET-PG INI-CET is concerned, everything you get access to when you take Mission 2.2. So you can go to the website cerebellumacademy.com. We suggest that you take 18 months back, because that is how we have scheduled this entire thing. That is how the structure has been made. And there would be a coupon code FMGE NEET. When you apply that, you would also get a good discount. So finally, students, to summarize everything, the biggest obstacle would be you thinking that I cannot crack NEET, or I cannot crack INI-CET, or I cannot get into top 100 or top 1000. That is lie. That is a big lie. Now there are enough students who have proven that when FMG students study, they can achieve everything. They can achieve anything. So you have to start. Do not waste time. Do not stay in that celebration mood for months, because as Goga sir said, you will start forgetting things. Follow a structure. We have also made a Telegram group specifically for our FMG students who are going to prepare for NEET-PG and INI-CET. Me, Goga sir, Vivek sir, Spurt sir, Zainab ma'am, sir, everybody would be in there. We'll keep on interacting with you. We'll keep on guiding you, but you have to start. Goga sir.
So last, I will want to say that just believe yourself. Follow the schedule, because many students are saying that we want to prepare for PG, but we do not know what to do. So this is what we have told, that what you need to do. And most importantly, let's meet at Cerebellum.
All the best.
All the best.